Okay, what if what you eat could be like the best medicine you have?
Interesting.
We're talking like way beyond just having more energy, you know?
Right.
This is about maybe seriously changing your health, like
Yeah.
managing some big-time conditions.
Yeah,
And a huge thanks to London Heartbeat's Z Academy.
absolutely.
If you're into this deep dive and you want like way more health info, they have over 150 courses on all sorts of stuff.
Yeah, well, that's a lot.
And you can follow them on Facebook, Instagram, Spotify, and YouTube for free updates and discussions like this one.
Very cool.
So today, it's specialized diets. We're going deep, straight from London Heartbeat C Academy's specialized diet in major clinical and special conditions.
Okay.
How using like certain diets can help with all kinds of health stuff. Diabetes, kidney disease, heart health, even like gut problems.
Yeah, there's a lot to cover. It's super comprehensive.
Right. Okay. Before we get into the details of each diet, why is nutrition so important for managing chronic diseases?
Okay, so think of it this way. With a chronic illness, your body's always fighting, trying to stay balanced,
Uh-huh.
and the right nutrition. It's like giving your body the tools for that fight.
I see.
It helps with like symptoms, healing, preventing things from getting worse.
So it's not just about treating the disease, it's about helping your body handle it.
Exactly. And this is like super important for stuff like diabetes, kidney disease, heart disease,
Okay.
where diet really matters both for managing the disease itself, but also like minimizing long-term damage.
That makes sense. So diabetes first. What's the main goal of a diet to manage diabetes?
So with diabetes, it's all about keeping those blood glucose levels stable.
Right.
And there's a few ways we do that. Careful carb monitoring, eating high-fiber foods that help slow down sugar absorption, and making sure we're getting enough good fats.
Okay.
All of those help improve insulin sensitivity, which is key for managing diabetes.
So it's not just cutting out sugar completely, right?
Oh,
It's about understanding how different carbs affect your blood sugar and finding what works for you.
exactly. That's why regularly checking your blood glucose is so important.
Makes sense.
It lets you see how your body reacts to different foods. Then you adjust your diet accordingly. It's like a personal approach to managing your blood sugar.
So understanding your body's reactions and making the diet match
Yeah.
seems like you got to pay attention to a lot of details, but managing diabetes well seems worth it.
Oh, totally. And speaking of making adjustments, when we get to kidney disease, we'll see how diet is super important for helping those kidneys work.
All right, the renal diet for kidney disease. What are the main things people do?
So with kidney disease, the kidneys aren't filtering waste from the blood as well as they should.
Uh-huh.
So the renal diet focuses on making their job easier.
Okay.
We do that by limiting sodium, potassium, and phosphorus. Healthy kidneys usually filter those out.
Right.
But when the kidneys are struggling, you have to be careful about how much you're taking in.
Why is it so important to limit those specific things for people with kidney disease?
Okay, well, first, sodium. Too much of that can make you retain fluid and raise your blood pressure,
Okay.
which puts more stress on the kidneys. Then there's potassium. High potassium levels can be bad for your heart if the kidneys can't filter them out properly.
Hmm.
And too much phosphorus. That can pull calcium from your bones, makes them weaker over time.
Wow. So it's not just about the kidneys themselves, it's about stopping a chain reaction of bad stuff throughout the body.
You got it. And often we also have to watch protein intake because when protein breaks down, it creates waste products.
Right.
And the kidneys have to work hard to filter those out. So it's about finding that sweet spot, enough nutrition without stressing the kidneys too much.
It sounds tricky, but obviously super important for keeping those kidneys healthy.
For sure. Now, let's switch gears to the heart.
Okay.
Diet is super important for preventing and managing heart disease.
Right. So what does a heart-healthy diet look like?
With cardiovascular disease, we want to reduce the risk factors
Hmm.
and promote good heart health overall.
Okay.
It all starts with loading up on fruits and veggies, whole grains, and lean proteins, and cutting way back on saturated and trans fats.
I see.
This combo helps lower cholesterol, keeps blood pressure in check, and reduces the risk of plaque building up in your arteries.
So choosing foods that help blood flow and reduce the chances of blockages that can cause heart attacks and strokes.
You got it. And just like with kidney disease, managing sodium is key for controlling blood pressure.
Right.
High blood pressure is a major risk factor for heart disease, so keeping sodium levels down is a powerful way to protect your heart.
It seems like sodium is something to watch out for with a lot of different health problems.
It really is. And don't forget about those good fats for your heart. Omega-3 fatty acids.
Oh, yeah. The ones in fish like salmon, right?
That's right. Omega-3s have been shown to lower triglycerides. That's a type of fat in your blood. They can also help reduce blood pressure and lower the risk of irregular heartbeats. So, eating fatty fish a couple times a week can be great for your heart.
So many things go into having a healthy heart.
Yeah.
All right, we've talked about diabetes, kidney disease, and heart health.
Mm-hmm.
What about gastrointestinal disorders? What are some of the diets people use to manage those?
This is where it gets really interesting. We see a whole bunch of different approaches depending on the specific problem. For example, people with IBS often find relief from a low FODMP diet.
Okay, what are FODMPs?
So FODMPs are these carbs that some people have trouble absorbing in their small intestine.
Okay.
And they can trigger all sorts of symptoms. Bloating, gas, abdominal pain, changes in bowel habits.
So finding and avoiding those trigger foods.
Exactly. A low FODM diet is about cutting back on those carbs for a while. See if things get better.
Well,
And then once you figure out your specific triggers, you can often add some FODMPs back in. Carefully, of course.
so it's like a detective game.
Kinda.
You got to find the culprits, then personalize your diet.
Yep. And then there's the gluten-free diet, which is super important for people with celiac disease.
Right. Because even a little bit of gluten can cause problems.
Exactly. With celiac disease, the immune system attacks the lining of the small intestine when someone eats gluten. And that damage can lead to all sorts of problems. So it's not just a preference, it's a medical necessity.
Got it.
Ready to dive into even more diets.
Yeah, let's keep going.
All right, next up is cancer nutrition support. Super important to help people through treatment and, promote healing.
Yeah, it's like giving your body everything it needs to fight back and recover.
Exactly. During treatment, the body's under so much stress.
Right.
So we want to make sure patients have enough calories and protein, for strength, for energy, for their immune system, which often takes a hit during treatment, and for healing tissues damaged by the cancer or the treatment itself.
It's not just minimizing the bad effects of treatment, it's about helping the body bounce back.
Totally. And sometimes specialized supplements are needed to address specific deficiencies. It's all about creating the best possible environment for the body to fight and heal.
Sounds like it has to be really individualized, right?
Yeah.
Depending on the cancer, the treatment, the person's overall health.
Oh, absolutely. Now, switching gears to HIV/AIDS, the focus here is on supporting the immune system, which obviously gets hit hard by the virus.
Makes sense. HIV attacks the immune system, leaving people vulnerable to infections and stuff.
Exactly. People with HIV/AIDS often need more calories because their body's working overtime fighting the virus.
Okay.
And maintaining a healthy weight is crucial too because weight loss is a common side effect.
So giving them extra fuel to support their defenses.
Right. And just as important is a balanced diet with plenty of vitamins, minerals, and antioxidants.
Right.
This helps the body deal with medication side effects and just, supports overall health.
It's amazing how much diet can impact managing such a complex condition.
It really is. And food safety is super important too, of course. Their immune systems are weaker, so they're more susceptible to foodborne illnesses.
Good point. That's a good reminder for everyone, but especially important for them. Okay, what about kids? What are some of the key things to think about with specialized diets for children?
Well, kids are unique because their bodies are always growing and developing.
Right.
So the right balance of nutrients is crucial for that.
And I imagine food sensitivities and allergies are more common in kids, too.
Oh, for sure. They're much more prone to them. And they can show up in all sorts of ways, from tummy troubles to skin problems and even behavioral changes.
So being aware of those potential reactions and working with doctors to figure out what's going on is key.
Absolutely. And for kids with things like autism or ADHD, where diet might play a role in managing symptoms, we might consider specialized diets as part of a bigger treatment plan.
So tailoring their diet to meet their specific needs and maybe even help with their development overall.
Exactly. And while we're talking about sensitivities, let's not forget about food allergies, which can be serious for anyone.
Yeah, this is serious stuff. Even a tiny bit of an allergen can be life-threatening for some people.
Absolutely. For those folks, avoiding their trigger foods is absolutely crucial.
And that means, like, really carefully reading labels, right?
Yeah.
understanding cross-contamination, and being aware of hidden allergens.
Exactly. And it's not just about being careful at home.
Right.
You have to educate everyone involved in the child's care. Teachers, caregivers, family, everyone needs to know about the allergy and how to prevent accidental exposure.
It's a team effort to keep them safe.
Exactly. Now let's talk about something called diabetes insipidus, which is different from the diabetes we talked about earlier.
I'm not as familiar with that one.
Yeah.
What do people focus on when managing it with diet?
So unlike diabetes mellitus, which affects blood sugar, diabetes insipidus involves a hormonal imbalance.
Okay.
It affects how the body conserves water, can cause excessive thirst and frequent urination.
So it's about staying hydrated instead of controlling blood sugar.
You got it. Often it's about drinking enough fluids to prevent dehydration and sometimes adjusting sodium intake to help the body hold on to water.
Interesting. We usually talk about reducing sodium.
It just goes to show how different dietary recommendations can be depending on the specific condition.
Definitely highlights why it's important to get personalized advice from doctors and dietitians.
For sure. Okay, let's move on to a topic that affects a lot of people: obesity and weight management.
This is a tough one. So many people want a quick fix and fall for fad diets that don't really work.
You're telling me sustainable weight management needs a multi-pronged approach. It's about diet and lifestyle.
So what does a healthy weight management plan look like, diet-wise?
It usually means making slow, gradual changes to your eating habits. Focus on nutrient-rich foods that fill you up without packing in the calories.
So it's not about starving yourself or cutting things out completely.
Nope. It's about making smart choices that you can stick with. And that's where things like mindful eating and understanding why you overeat can be really helpful.
It's about getting to the root of your habits and finding healthier ways to cope.
Exactly. And don't forget exercise. It not only burns calories, but it also helps with mood, boosts metabolism, and it's just good for you overall.
So it's about a whole lifestyle change, not just diet, but movement too.
For sure. Now remember, celiac disease. Let's go back to that for a minute and talk about why going gluten-free is so important.
Yeah, because even a little gluten can cause damage for people with celiac disease.
Right. Their immune system sees gluten as a threat and attacks the lining of the small intestine.
Wow.
And that damage can lead to all sorts of issues with nutrient absorption. So it's not a choice, it's essential for managing the disease.
Sounds like it takes a lot of awareness to avoid hidden sources of gluten.
Totally. Reading labels and being super careful about cross-contamination are super important. Luckily, there are tons of gluten-free options available these days, so it's easier to stick to.
That's good to hear. What's next?
All right, let's talk about some of the diets people use for managing neurological conditions. One that's gotten a lot of attention lately is the ketogenic diet.
The keto diet, yeah.
That's the one. Super high fat, moderate protein, very low carbs.
Right. I know people use it for weight loss, but it started out for something else, right?
Yeah, it actually has a long history of use for epilepsy, especially in kids who don't respond well to regular meds.
Interesting. So it's like a medical diet that's been, I don't know, repurposed.
Kinda, yeah. By cutting carbs drastically, the keto diet forces the body into ketosis. That's where it starts burning fat for fuel instead of glucose.
I see.
And that change can really help control seizures for some folks with epilepsy.
Wow, changing the body's fuel source can be really powerful.
It really is. And beyond epilepsy, there's growing interest in using keto for other neurological conditions, like Alzheimer's and Parkinson's, although we need more research on that.
Definitely sounds promising.
It does. And along with keto, there's more and more focus on how diets rich in antioxidants and omega-3s can support brain health, maybe even protect against cognitive decline and those neurodegenerative diseases.
So not just managing symptoms, but maybe even affecting the long-term health of the brain.
Right. Of course, with any specialized diet, working with a doctor or a registered dietitian is crucial.
Definitely.
They can help you figure out the best approach and make sure you're getting the nutrition you need.
Personalized care is key. Now, what about pregnancy and lactation? I mean, a woman's body goes through huge changes during those times.
Huge changes, and her nutritional needs go way up too. The baby relies on her for everything, and her body needs extra support for all of it.
The way the body adapts is amazing.
It really is. A balanced diet is super important during pregnancy. Getting enough calories to support the baby's growth, plus enough protein, essential fatty acids, vitamins, and minerals.
Are there any specific nutrients that are especially important during pregnancy?
Yeah, a bunch. Iron, for example, is essential for making red blood cells.
Right.
And you need more of those during pregnancy to carry oxygen to both mom and baby. Folate is super important too.
Okay.
It helps the baby's neural tube develop properly. That forms the brain and spinal cord. Then there's calcium for strong bones and teeth. And omega-3s, particularly DHA, those help with brain and eye development.
It's a lot to keep track of,
Yeah.
but so important to get all those nutrients.
For sure. And there are some foods that should be avoided during pregnancy.
Okay.
Things like raw fish and unpasteurized cheeses because of the risk of foodborne illness.
Right.
And alcohol should be avoided completely. It's all about protecting the baby.
Absolutely. And some women need extra help managing things like gestational diabetes, which
Yeah.
affects blood sugar control.
Yeah, that's another one that needs careful monitoring.
Pregnancy really seems like a time when personalized care and close monitoring are essential for both mom and baby.
Totally agree. Okay, let's move on to chronic inflammatory conditions, where diet can play a big role in managing symptoms and just feeling better overall.
It seems like inflammation is behind so many health problems these days.
It's a big contributor to a lot of chronic diseases, like heart disease, arthritis, even some types of cancer.
Wow.
The good news is, diet can really influence inflammation in the body.
Okay.
Anti-inflammatory diets focus on whole foods that help calm things down and promote healing.
So choosing foods that soothe instead of making things worse. What are some good anti-inflammatory foods?
Think colorful fruits and veggies, packed with antioxidants.
Okay.
Things like berries, leafy greens, citrus fruits. Fatty fish like salmon and tuna are great too. They're rich in omega-3 fatty acids, which are really good at fighting inflammation.
Right.
Nuts and seeds are good too. They provide healthy fats and fiber. And herbs and spices, things like turmeric, ginger, garlic, those have been used for their anti-inflammatory properties forever.
Sounds delicious.
It is. And don't forget about limiting things like processed foods, sugary drinks, and unhealthy fats. Those can all contribute to inflammation.
So shifting towards more whole foods.
Yeah. And it's not just about food. Lifestyle factors are important too. Exercise, managing stress, getting enough sleep. All those help with inflammation and overall health.
It's about looking at the whole picture, not just diet.
Exactly. Okay, ready to get a little deeper. Let's talk about the connection between nutrition and mental health.
Oh yeah, this is fascinating. We're learning more and more about how much our gut health and diet affect our brains.
It's super interesting. We're finding that what you eat can really impact your mood, how well you think, and your mental health overall. And the gut microbiome, all those trillions of bacteria in your gut, are really important here.
So it's not just what's going on in our heads, it's what's happening in our guts too.
Exactly. And some nutrients are particularly important for mental well-being. Omega-3 fatty acids, for example, those can help with mood and reduce symptoms of depression and anxiety.
Interesting.
B vitamins are crucial for brain function and energy, while minerals like magnesium and zinc help with mood regulation and stress response.
It's incredible how connected everything is.
I know, right? And while diet can't cure mental health conditions, it can definitely help manage symptoms and support overall well-being.
Right.
Eating well can give your brain what it needs to be healthy and help keep your mood balanced.
So it's part of a holistic approach, along with things like therapy and lifestyle changes.
Exactly. Okay, ready to talk about the future? Let's dive into personalized nutrition and genetic factors.
This is where it gets really high tech, right?
It is. The field of nutrigenomics is growing rapidly, and it allows us to tailor diets based on a person's genes.
Wow. So it's like a personalized nutrition plan based on your DNA.
That's a great way to put it. By looking at someone's genes, we can see if they're predisposed to certain conditions and then adjust their diet accordingly.
So if someone is genetically predisposed to heart disease, you might recommend a diet specifically designed to lower their cholesterol and blood pressure.
Exactly. It's about taking preventative health care to the next level, using your genes to guide your food choices.
That's amazing.
And it's not just about preventing disease. Personalized nutrition can also be used to improve athletic performance, sleep, and just overall well-being. It's
Yeah.
all about matching the diet to your specific genetic blueprint.
It's incredibly personalized.
It is, and it requires expert guidance. You really need to work with healthcare professionals who understand nutrigenomics. They can help you understand your genetic data and create a safe and effective plan.
So it's cutting-edge science combined with personalized care.
Exactly. And as research continues, we can expect even more precise and targeted dietary interventions. It's really exciting.
It's amazing to think about how much we've learned about nutrition and how to use it to improve our health. It's crazy to think we might be heading towards like truly personalized nutrition,
I know, right?
where your diet is based on your genes, not just what health problems you have.
It's a pretty amazing thought. Imagine preventing diseases and stuff just with food based on your DNA.
It feels like a whole new world for nutrition and healthcare.
It really does. And as this knowledge becomes more mainstream, integrated into how doctors treat us, it could totally change how we manage our health throughout our lives.
So, listener, think about this. We've talked about a lot today. Specialized diets for all sorts of things: diabetes, heart disease, gut problems, neurological conditions, pregnancy, childhood, even HIV/AIDS. It's a lot.
It is, and we've seen how powerful food can be, right? For managing these conditions, helping the body heal, and just improving quality of life.
I'm definitely feeling inspired to make some changes myself. What about you?
Me too. But remember, the key is to find what works for you, your needs, your preferences.
Totally. And that's where those healthcare pros and registered dietitians come in.
Right.
They can help you navigate all this, make it safe and effective, considering your health history, your lifestyle, all that.
Think of them as partners in this journey. They can help you make good decisions, create a plan that works for you, and give you support along the way.
So now that you've heard all about these specialized diets, what stands out to you?
Yeah, what are you curious about?
What changes might you want to explore? Maybe you're interested in those omega-3s for your heart, or all that fiber for your gut.
Maybe you're wondering about a low FODMAP diet for your digestion, or an anti-inflammatory diet to help with aches and pains.
Or maybe you're thinking about nutrigenomics, personalized nutrition based on your genes. Whatever it is, remember, knowledge is power. The more you understand about food and your body, the better choices you can make.
So keep learning, keep exploring. Don't be afraid to try new foods.
And reach out to the experts, doctors, dietitians, nutritionists. They can help you on your journey.
They can help you take all this science and turn it into something you can actually use every day.
Well, that's it for our deep dive into specialized diets. We hope you learned a lot and are feeling inspired.
We hope so. Keep exploring this amazing connection between food and health.
Remember, food can be so powerful for healing, for preventing problems, for feeling your best.
Make good choices, listen to your body, and enjoy it.
Until next time, stay curious, stay informed, and bon appetit.